My involvement in Pioneer is as member of the EAU guidelines. I'm in charge of the Work Package 7. And which is the role of this Work Package 7? I'm co-leading this with our FPI partners, and the main goal of this Work Package is just communication, the dissemination strategy for Pioneer project. That it's really important. Why? Because for sure that Pioneer has as main goal to produce outcomes, but if these outcomes are not disseminated, they wouldn't be implemented. So a good dissemination strategy is fundamental. What is real-world data? So it's that data that already exists, that doesn't come from a design randomized trial. It's the data of our patients. We obtain data from everywhere. The wearables, the electronic health records, the databases that recruit our data. In fact, we are living our whole life dealing with real-world data. We are giving our data to a lot of sources. But real-world data means that the data of the patients that we treat for a specific disease that comes from different sources, and that we want to use to really understand what is happening in our population in a specific topic or in a specific disease. If we have this data, the real-world data, the massive data coming from a very large population of patients under a specific circumstance, if we can analyze this data, probably we will be able to obtain evidence in certain things that, for example, the trials that we have already designed doesn't give us enough evidence. We don't know, for example, how the common population, all the population respond to a specific therapy, or which is the natural history of a disease. If we are able to obtain this data and we analyze this data, we will be able to obtain real-world evidence. Randomized controlled trials are the base of our evidence-based medicine. What does it mean? That systematic review, meta-analysis, randomized controlled trials is the way that we have been using for years to obtain evidence. If I compare a group A to a group B, then in the same circumstances, but with a difference of a therapy that I apply to each group, I'm able to demonstrate with a good methodology if this therapy is better for this group or not, or if this strategy is better for this group or not. Randomized controlled trials are the base of the evidence-based medicine, and they have been the pillar for establishing our recommendations for therapy, follow-up, diagnosis. So they are really great. What happens with randomized controlled trials? That sometimes we design them not taking into account the whole population. For example, we don't accept patients with comorbidities, patients with renal impairment function, patients over certain age. Well, we can demonstrate in the population that we have designed that therapy is good for this. But what happens with the rest of the population? That is the population that we used to treat. So randomized controlled trials serve us to put and to obtain a good evidence. Then we need to demonstrate it, that these outcomes are applicable to the rest of the population. I think that the main advantage of analyzing real-world data is that they will help us to understand areas where still we don't have evidence. For example, in our EAU guidelines, we are producing recommendations for different diseases, and there are some of them that are strong recommendations because they are based on high level of evidence in a randomized controlled trial, systematic review. This is the way to produce strong recommendations. You should do A for this patient in these circumstances. But not everything in medicine could be tested in these ideal circumstances. So there are some lack of knowledge that we cannot cover with this type of evidence. Real-world data will give us the information in these areas where we don't have systematic review, randomized controlled trials, this strong evidence that we need to support recommendations. The impact of real-world data into clinical practice, still we are learning how to do it. We are all aware that real-world data is a key for obtaining the information we are looking for, and that we have not yet been capable of establish. But how we will transform this information into real outcomes is something that we need to learn. We need to understand which will be the validity of this data that we obtain from this massive observational analysis, and how to transform into real recommendations. Because it's not only that we have this data, we need to learn what to ask to this data. Because if I have all the data, but I don't do the proper question, I won't obtain any outcome. So first, I need to be sure and clever enough to do the proper question. Then to analyze the data in a right way to answer that question. And once I have that question solved and answered, then I need to learn how to apply and how to convert into recommendation. I think that at this moment, the EAU guidelines and EAU in general is doing a great investment in how to deal with real-world data for achieving that finally comes into application for real healthcare. It's for that the Pioneer already exists, because it's an initiative on how to do that and how to apply this real-world data into real healthcare. So I think that all of us are learning, and these joint ventures and collaborative projects are the key to really understand how this process should be done.